Hi everyone. Today we are going to present the group presentation in the module of Global Operations 7400 SSL. And our topic is adopting lean production principles, opportunities and challenges for NHS UK. And our team members, the first one myself, Gautam Gopalakrishnan, 13965646. The second one is Kendi Dennis Aladitan, 13347 200. And the third one is Olabode Joshua Ogundeep, 13506162. Then the last member is Linsha Varaketu Sajahan, 13554299. Introduction to lean production and its origins. Lean production defined a systematic approach to minimize waste without sacrificing productivity. The origins in brief emerged post in Japan's Toyota Motor Company sought efficiency in scarce times. Central principles, continuous improvement and elimination of non-value added activities. Relevance today. Transcended beyond manufacturing, embraced globally across sectors for su- sustainable, efficient operations. Evolution of lean production. Origins in post-Japan. Born out of necessity due to resource scarcity, aimed to maximize value while minimizing waste. Toyota production system, pioneered by Toyota in the 1950s, introduced just-in-time and Kaizen principles. Western adoption. In 1980s and 1990s saw lean principles adopted in the West, especially the US, recognized for its efficiency and production quality improvements. Beyond manufacturing, late 1990s and 2000s, lean principles applied in services, healthcare, and IT sectors, adapted to suit non-manufacturing environments. Modern day lean continuous evolution with technologies like Six Sigma for process improvement, widely recognized and implemented across various industries globally. The second slide is significance of lean in today's world. Adaptability. Lean principles have proven flexible, adapting beyond manufacturing to sectors like healthcare, IT sectors, and finance sectors, etc. The second one is technology integration. Modern lean integrates for real-time monitoring. The third one is globalization. Lean strategies now account for global supply chains, addressing challenges of distant supplies and markets. Fourth one is sustainability focus. Lean today often incorporates eco-friendly practices aiming for sustainability alongside efficiency. The fifth one is customer centricity. Modern lean emphasizes deepening customer relationship, pivoting from just waste product reduction to value creation.
Thank you, Guatem. Still on the lean and an overview of the choosing company, that's National Health Service. An overview. The National Health Service Act of 1946 came into effect in July 5th, 1948. Do you know that NHS UK is made up of 1.3 million people who care for the people of this country with skill, compassion, and dedication? The National Health Service in the United Kingdom is a publicly funded health care system that provides medical services to residents for free at the point of use. The need for lean principles, the need for lean principles and practices in this national health scheme has been a topic of discussion and implementation for several years. Please go to the next slide. Potential benefits of lean for UK for national health scheme in the UK. In the context of national health scheme, lean can play a significant role in addressing various challenges. Efficiency. Lean principles aim to streamline processes and eliminate waste, which can lead to increased efficiency. Cost of reduction. improve patients' experience, quality improvement, engagement of staff. In addition to the potential advantage of implementing Lean in the UK's National Health Services, as mentioned in the slide, it is evident that the adoption of Lean principles will enable the NHS to optimize productivity and minimize inefficiency. The use of Lean practices in the NHS is expected to yield various benefits, including enhancement of quality, productivity resources, utilization, lead times, customer service, customer satisfaction, employee satisfaction, and sustainability. Challenges, challenges in implementing Lean at the National Health Scheme, UK. In implementing Lean principles in a complex healthcare system like the NHS comes with various challenges. While Lean can bring about significant improvement in efficiency and quality of care, it requires a cultural shift and careful planning to overcome these challenges. The challenges are cultural resistance, complexity of healthcare, patient-centered care, resource constraints, data and measurement challenges, training and skill development. Despite these challenges, Lean principles can be adopted and successfully implemented in healthcare systems like the NHS. Overcoming these obstacles often required a phased and managed approach. Clear communication, staff engagement, and a commitment to continuous improvement, learning from successful Lean implementation in healthcare settings worldwide can also provide valuable insight for the NHS. Thank you.
Yeah, thank you, Mr. Kendi Aladito. Going to the next slide, we'll be seeing the National Health Scheme UK's current strategy and SWOT analysis. NHS long-term plan introduced in 2019 to transform patient care. They have emphasis on digital innovation and integration of care across primary and secondary services. Increased funding by an average of 3.4% annually up to 2023 and 2024. Focus on prevention and personal responsibility and health inequalities. And they also, one of their strategies is also to boost mental health services with increased funding and focus. So now let's analyze them by using the SWOT analysis. What are their strengths, their weaknesses, their opportunities, and the threats they are faced with? Number one, for the strength, we have established infrastructure. Yeah, they have a kind of established, they have been established in terms of infrastructure. They have dedicated workforce, trust and credibility among publics. Yeah, they have gained the credibilities of the publics. The weaknesses, they have funding constraints. They are not receiving much funds probably from the government. Increasing demands with aging population, historical inefficiency in some sectors. What are the opportunities? Digital transformations, partnership with private sectors. They have been able to partner with the private sectors, yeah, and also focus on early detection and prevention care. What are the traits that they are being faced with? Well, number one, we have the political interventions, rising cost of treatments, dependence on overseas stars amidst geopolitical uncertainties. Moving on to the next slide, we are going to be seeing the strengths and opportunities of National Health Scheme UK. What are their strengths? They have a universal coverage, provide health care for all UK's residents, regardless of income. They have integrated services. They combine general practice hospitals and ancillary service for a holistic approach. They have a very trained workforce. They employ a vast number of skilled healthcare professionals. Public trust. regarded as a national treasure by many UK citizens. Like I said earlier on, they've been able to gain public trust. And what are the opportunities? They have digital transformation. They have potential to integrate advanced digital solutions to patient care, collaboration, opportunities to collaborate with private sector for advanced treatments, research and development can leverage its large database for medical service and health education, extend outreach programs educating public on health and awareness. Moving on to the next slide, we are going to be seeing the weaknesses and threats in NHS current strategies. Like their current strategies, what are the weaknesses and what are the threats that they are being faced with? Number one, we have the staffing shortage. Yes, chronic understaffing leading to overworked healthcare professionals. They don't have enough staff on yes. And secondly, waiting time, extended wait time for non-urgent surgeries and consultation, budget constraint. They have limited funding affecting service quality and infrastructural upgrades. Bureaucracy, complex administrative procedures slowing down patient care delivery, aging infrastructure, outdated facilities and equipment in same region. What is the external threats? Increasing private healthcare competition, potential health crisis and pandemic stretching resources thin, digitalization lag, slower adoption of advanced healthcare IT solution. The next slide shall be discussed by one of my colleagues.
Thank you. Now we have to discuss overcoming challenges in lean implementation. Employee training, leadership buy-in, continuous feedback loop, pilot implementation, external expert consultation, cultural sensitivity, and clear communication. The first one is employee training. Offer comprehensive training sessions on lean methodologies and including real life case studies to showcase benefit. And the second one is leadership buy-in. Ensure top management understand and support the lean transition and allocate resources for effective lean implementation. The third one is continuous feedback loop. Establish a system for employees to provide feedback during the transition. Make necessary adjustment based on the feedback. And pilot implementation. Uh, these are start with a smaller a department or unit for learn transition and analyze result learn and then expand to other departments. External expert consultation. Hire learn expert for initial guidance and to tackle complex challenges. Use their insight refine the NHS learn strategy and the cultural sensitivity. Recognize the NHS has its own unique culture. Adapt learn methodologies in a way that respect and integrates with this culture. And the last one is clear communication. Ensure all staff members understand the reason behind lean adoption. Clearly communicate the long-term benefit for the both NHS and its patient. Now we can concluding thoughts. Importance of lean in NHS UK. Enhance efficiency and streamlines process. Reduce wasteful activities leading to cost saving. Improve patient care and satisfaction. Potential better allocate resources and manpower. Challenges implementations. Resistance to change from staff and management, initial training and development costs, potential misunderstandings of lean philosophy, monitoring and continual adjustments required for effective implementation. Um, then future path and recommendations for NHS in UK. And the key takeaways are the NHS potential to significantly benefit from lean, importance of addressing challenges in lean implementation, lean's role in enhancing efficiency, reducing waste, and improving potential care. Recommended action for NHS in UK is conducting learn training workshop for all staff at all levels, Establish a dedicated lean implementation task force. Prioritize areas with the most wastage inefficiencies and engage with lean expert for initial implementation phases. And the last one is regularly review and refine lean strategies based on feedback and results. These are the reference. Thank you. Thank you all.
Yeah, thank you.